medicine program at American University of Beirut, head of the division of plastic surgery, and has just written a superb book I can thoroughly recommend if you're into war surgery, Reconstructing the War-Injured Patient, which came out relatively recently. And our final speaker and panel member today will be joining us shortly is Professor Rita Jacquemin, and I'll introduce Professor Jacquemin later when she actually joins. So let's kick things off. We're going to have a talk from each of our panelists and then a kind of wide-ranging discussion. And we'll be posing questions from the chair, but also please do send in questions and comments as we're going along, and I'll corral those together and pose them to the panel members. And we're going to be talking for around 50 minutes to an hour. So without much ado, Fouad, the floor is yours.
Thank you very much, Richard. And can I share the presentation, or should I do it from my side, or?
You can indeed. Do you want? Can you share this? Can you?
I can. So no problem. I can
Brilliant.
do it. So it's fine. If I can do it, it's okay.
You can share screen and show the presentation.
Okay. I think this is the one. So share. Is it clear now?
Yes, it's coming up. Perfect.
Okay. Okay. Thank you. So actually, I will try to put sort of the context of the region, the MENA region, but we'll focus more on the Arab countries plus Turkey, because actually these are the countries of interest of our work at R4HC, but even more, those are the countries that face many and different challenges. So okay, so just to have some numbers, first pure numbers, the Arab countries till today, actually this morning, so they have almost more than 500,000 cases, with mainly actually 70% of these, 75% of these cases are in 6 countries, the GCC countries, the Gulf state countries. And the interesting to know that these countries are the richest, the wealthiest countries in Arab countries and in MENA region. Turkey actually also faced sort of the fastest increase of numbers of cases worldwide in less than actually the month, between late March and late April. The entire 21 provinces in Turkey were affected by the cases that by COVID, and they have almost 200,000 cases. The number of deaths is relatively low in these countries. What are actually the special consideration that need to be noticed in the region? The MENA region, Arab countries, actually faces a sort of a long run humanitarian emergencies. In many countries, at least half of countries of the region either have direct conflict or political instability, or consequences of this conflict, including refugees and IDPs. But also, if we're talking about the GCC countries, we have another feature, which is the very high number of migrant workers and migrant and domestic workers. This is an example from Lebanon. Up till today, we have a relatively small number of cases, 1,600, with 33 total deaths, mainly in the urban settlements and urban settings in Lebanon, in the capital, and in some of the major cities. Well, what are the challenges that face the most vulnerable population in the region? I mean the migrant and refugees. First, they have very poor access to preventive, procedures and capacity during their poor living conditions. Also, they have barriers to access to healthcare facilities, including legal barriers, and because of lack of movement, lack of document, discrimination. So all these issues affect their access to healthcare. In addition to the very huge and great economic difficulties. This slide I picked up from one of the articles mentioned about Syrian refugees in Lebanon. Interesting that a few days ago I was reading this article by Ron Smith talking about isolation through humanitarianism. So and at the same time, that quote in this article about the Syrian refugees in Lebanon. So I'm quoting here, from this newspaper. So Syrians have the right to go out only between 9 and 11 a.m. So they have only 2 hours a day to move around, which is different from the official lockdown policies in Lebanon. So the question is, the main question is this sort of the widespread lockdown that used the global one, the one that run in the US and in Western Europe, to have like a complete lockdown. So the question in the region is that the right strategy, given the entire difficult situation from having the most vulnerable population, having economic difficulties, having like a sort of disparities, social disparities? Is it the right lockdown? If we look on one indicator, which is the number of deaths up till June 10th or 12th actually, we have 11,000 deaths in Arab countries and Turkey, out of the total population of 500 million. Whereas the number of deaths in UK is more than 40,000, and only in one city in the US, 30,000 deaths. So it seems that for many reasons, it's not for the discussion today, for many reasons, the number of deaths, even if there is sort of sometimes underestimate, but still the number of deaths in these countries less than the counterpart in the West. So, so the question, if we look into, on the other side, the economic part, and I'm trying to see it here from the political economy of health in such a humanitarian settings. If we look into that economic part, according to the ESCWA, this United Nations Economic and Social Commission for Western Asia, they estimate that the impact of lockdown in the region could lose almost 42 billion of the GDP in this country, and the unemployment rate will increase by 12%, and that will actually will lead to lose almost about 1.7 million jobs in 2020. So this example about Lebanon that started sort of a strong restriction procedures early in March 15, where they declare a medical state of emergency, and immediately after that, they went through complete lockdown till late of May. So if we look into the some figures about the economic situation in Lebanon, even before COVID, in September 19, the IMF said Lebanon face high twin deficits, a large public debt, and low growth. Actually, because of that, in October 19 of 2019, an uprising erupted in the country all around the territories in Lebanon in response to that sort of economic crisis. But unfortunately, that didn't change, the situation, the political situation, and led to more severe financial crisis. Banks are, dried from the dollars and foreign currency, and the World Bank estimate that Lebanon will lose almost like 300,000 jobs in 2020. For the Syrian refugee, for the workers in Lebanon, according to ILO, there's they mentioned that more than 80% of workers in Lebanon were either permanently or temporarily were laid out from the work because of, as a consequence of COVID-19, and mainly Syrian workers who are, in the informal sector will be affected by double of the Lebanese workers. And among those Syrians, 60% will permanently laid out of the from the work, comparing with the 30% for sort of temporary laid out. This will affect severely the ability of Syrians and, of course, Lebanese counterpart workers to have access to health and to other protective procedures. This slide mentioned about the economic pressure that Syrian refugees face in Lebanon, where 70% live under the poverty line, and 50% of them are extremely poor, under $2.8 per person per day. So one of the effect on health will be the this is an example about the measles campaign. So Lebanon, for example, like many other countries, postponed the campaign till the date of this year. So just to sum up quickly and leave the other for discussion. So we know that this country, the main affected countries are Gulf states, where 80% of those who of cases are among migrant workers, whereas in countries that affected with wars and instabilities, refugees and IDPs are at the higher risk to be in the second wave of COVID in the region, unless there's a sort of innovative approach to tackle that. I will stop here and leave the others for discussions.
Thank you so much for kicking us off so eloquently. Some extraordinarily sobering figures there, many actually I've not seen before. So we're going to respond to that by asking, if I can, maybe Ghassan to go first. So thank you very much, Fouad. We'll bring you back into the panel discussion in a moment. Ghassan, the floor is yours.
Good morning, first of all, and thank you for asking me to speak. I want to basically discuss the issues that are being highlighted by the pandemic and what the pandemic has shown itself to be. Can I just, before we start, ask if anybody can hear me? Because I've got a kind of sense that I'm speaking in a vacuum.
You are being loud and clear, Ghassan.
Oh, perfect. So major epidemics and pandemics, in my opinion, can be broken down into one of two. They can either be events or they can be crises. Events, as described by Badiou, are basically occurrences that create a break from the linear progression of socioeconomic conditions, i.e. they create a new reality. And crises, as described by Foucault, actually are stressors that become almost an epiphany of the current situation. And so if you want an analogy, if you've ever seen pictures of these structural engineers who have measure weaknesses in material by putting them under a compressor, and that compressor eventually delineates all of the cracks in the system simultaneously. And I believe that this pandemic has done that across the globe. So from the incidence of, from the mortality rate of African Americans in the United States to what Fuad was talking about with regards to migrant workers in the Gulf states, to the relationship between the Palestinians living in the West Bank and the Gaza Strip with settler colonialism in Palestine, and with the issue of Palestinian and Syrian refugees in Lebanon. And so what we have found is that this stressor, this crisis, has created a delineation of therapeutic geographies that had been previously not as obvious to us. So the therapeutic geographies affecting the life of migrants across the world, or the therapeutic geographies of Syrian and Palestinian refugees within Lebanon and vis-a-vis the Lebanese therapeutic geography. So what has happened when this pandemic occurred is that suddenly we saw that despite the fact that these three groups, Syrian refugees, Palestinian refugees, and the Lebanese population, occupy the same political geography, they actually occupy different therapeutic geography. And so immediately there was a curfew on the movement of Syrian refugees in and out of a lot of Lebanese villages and towns. There was immediately talk that the army should surround refugee camps and prevent the movement of refugees, because most likely they'll be the harbingers of the infection. At the same time, what it did delineate with regards to the therapeutic geography is the issue for me of sovereignty. Sovereignty and agency within these two populations. So unfortunately, what for me the pandemic highlighted is that despite the fact that the Syrian refugee crisis in Lebanon is almost 10 years old, the international community, INGOs, UN agencies are complicit in the denial of agency and representation to Syrian refugees. And so the ability of the Syrians in Lebanon to mobilize independently and to create a voice that is trying to find intrinsic solutions to this crisis and to meet the challenges that are being thrown up against the movement of Syrians, the employment of Syrians, and the risk that Syrians face within very difficult social and economic conditions. We found that when push came to shove and the pandemic happened, humanitarianism, which is unfortunately a depoliticizing and disempowering political economy, had left the Syrian population in Lebanon voiceless and without the tools of mobilization and organization. This compared to the Palestinian refugees, who have had to revert to political institutions that had been created prior to 1982 by the PLO, by the Palestine Liberation Organization, that organized Palestinian political life within Lebanon. And so the Palestinians, after very worrying statements by heads of right-wing Lebanese political parties and also some political advisors close to the president, the Palestine Red Crescent Society, which is a part of the Palestine Liberation Organization, started to organize within the Palestinian refugee community quarantine areas, reallocating some of the hospitals to treat potential COVID cases. And so we see that how the stressor has actually highlighted different issues within the concepts of, within the spaces of therapeutic geographies that had been invisible or only visible partially before the crisis. The other issue that I see with regards to the pandemic and its relationship with therapeutic geographies in the region is that these therapeutic geographies in the region have always been porous. And by porous, I mean that their dysfunctionality had allowed people to negotiate their way around them. And by that, I mean, you know, the collapse of the Iraqi health system meant that Iraqis sought healthcare outside Iraq, in Lebanon, in Syria, in Iran, in Turkey, that the Palestinians were able to rely on money coming in from the Palestine Authority in the West Bank to pay for private sector healthcare in Lebanon, that Syrians were able to send their families back and forth across the border for some treatments back in Syria and then come back. But what happened is this pandemic had sealed these therapeutic geographies. And so any mechanisms by which there was some cracks in the system that people could use to escape these geographies were sealed. And so now Syrians are not able to go back and forth. Palestinians have stopped receiving any kind of financial support because of the crisis in the Palestine Authority. Iraqis cannot travel, and even I understood from MSF that the MSF, because of the crisis in Iraq, has had to convert all of its hospitals that were dedicated to the treatment of war wounds in Iraq to COVID hospitals. And so suddenly we see a stressor, and suddenly the whole thing lights up like a Christmas tree, where rather than seeing political geographies, we see therapeutic geographies emerging in the region as a result of the weakness of the state and the collapse of borders and the movement of millions of people across these borders. So what I want to finish off by basically saying we need to explore the political economy of these therapeutic geographies better. And we need to engage with political geographers, with political economists, with sociologists, with political scientists, with anthropologists, and public health professionals and public health practitioners to begin to understand these spaces that have been so clearly delineated as a result of this crisis. Thank you very much.
Ghassan, wonderful. Thank you very much for that extremely eloquent discussion, and very wide-ranging as well. I think there's a whole range of issues. I think we'd like to sort of pick up on that, and particularly like the juxtaposition between the impact on Palestinian refugees and those on Syrian, picking up for where Fouad left off as well. And also the sealing of porous borders within therapeutic geographies. I think that's something I think we could just expand a little bit on again in the panel discussion. But before we go to that, I would like to turn to our final but last but by no means least speaker for today's discussion. And it's a huge pleasure to present Professor Rita Jackaman, who's Professor of Public Health at Birzei University. She's also Director of the Institute of Community and Public Health in the occupied Palestinian territories. And for those of you who don't know, Birzei University is in the West Bank. Reacher, very warm welcome. Thank you very much for being on board today and for talking to us. And for those of you wondering, the video link is a bit unstable, so Rita will just be talking to us. So Rita, the floor is yours.
If you can just put the video on for a second, just to say hi, so people can see my face.
Let me see if I can, hang on a second. I think...
Oh, I can't do it here.
Yeah. Yes, we can see your face.
Everybody. Okay, now we can put it off if you don't mind.
Wonderful.
Otherwise, I stop hearing. Hi.
Good. All right, hang on a second. Let me do that for you.
Yes. Okay.
Good. Already.
What an interesting discussion. Fuad and Ghassan, thanks so much. But, I would like to continue with the thread that Ghassan began. And I would like to say that in Palestine, in the occupied Palestinian territory, West Bank and Gaza Strip, we are not only living therapeutic geographies, we are living the geographies of enclaves. I mean, take a look at what's happening. The Gaza Strip is completely choked by a siege that has been going on, intensified since 2007. The West Bank is cut up into areas A, B, and C, and area C is about 60% of the West Bank and our breadbasket, and it's up for imminent annexation. And in between, there are numerous Israeli army checkpoints and also Israeli illegal settlers. Now, this is what the young generation calls settler colonialism. We used to call it colonialism, but they are right. It's settler colonialism. And the idea that Patrick Wolf raised here when he was here about a couple of years ago was that our situation is much worse than the settler colonial situation of South Africa. The reason being is that in South Africa, they wanted to keep the Black people so they could be laborers. Here, they want the land without the people. And so here is a situation where we are captive, we have a starved economy, starved health services, we also have no control over land, border, air, water resources. And in the situation, we also become captive to the COVID-19 pandemic. And it has become an impossible situation, although we have tried as much as we can to contain the situation. The COVID-19 cases first came to us via Greek tourists and pilgrims on March 15, immediate lockdown for 2.5 months, a bit more. And then people began to protest. They want food on the table. So it eased up. And right now, the last 3 or 4 days, the spike is amazing. And it has reached Palestinian refugee camps. These are people living in refugee camps for over 70 years because of the 1948 Arab-Israeli war and the creation of another tragedy to solve the Jewish question. Europe created yet another tragedy, which is the Palestine tragedy. And as a result, we have Palestinian refugees here in the Gaza Strip, in Jordan, in Syria, and in Lebanon, and of course, elsewhere. So this is the situation. It's becoming uncontrollable because our hands are tied. We don't have the possibility to do very much except lockdown. The problem is, who is responsible for Palestinian people's health? The Palestinian Authority and Hamas have tried very much, but they can't cope. And all the conventions relevant to the situation of Palestine tell us that the responsibility for the health of unoccupied people is that of Israel. And yet Israel refuses to assist, refuses to, for example, reduce the choking seas on the Gazans, nothing doing. Or, for example, testing people who are Palestinian workers in Israel coming home, because about at least 2/3 of the cases have been contracted via a contact with Palestinian workers in Israel after they came home. So that's one question we need to raise. The other question we need to raise is what about humanitarian aid? I agree completely with Ghassan. The divorce between humanitarian aid and justice is a killer. It's a killer. It keeps people just above water, suffering with no end in sight. The problem of humanitarian aid has been that it consistently avoids politics, and actually our problem is not about food, and our problem is not that we are mad, so we are given medications and therapies. Our problem is that we are suffering, and suffering terribly, and now with COVID, we have compounded suffering, and yet humanitarian aid is not willing to raise the issue of politics and justice. And given the situation, I don't know what will happen. We will have to endure. We Palestinians have been known to be what is called resilient. I really don't like this word at all, because resilience comes from engineering, and it means that you go back to where you were. To me, Palestinians have been able to endure, have the capacity to endure, but also resist. And we resisted for at least 100 years now injustice. What is needed is not merely hand-to-mouth type aid, or just a bit of aid as a result of COVID. What we need is justice and our freedom. And we would be able to take care of ourselves pretty well, because we are an educated people and quite capable, but we have been constrained by a terrible political reality. I think, one last point. I think it's extremely important not to lump everybody together. For example, with the COVID-19 situation, some research, our research and others, is indicating that some population groups are more vulnerable than others. For example, we seem to have a situation where, because of lockdown, more cooking, more and home teaching, etc., women have had the bulk of the care and the home teaching, and it's becoming unbearable for some women. The other group that needs to be really looked at is what happens to people people with disabilities. What is happening in a situation where disability generally is stigmatized and not prioritized, neither by government nor by community? A third category is young people. It was really interesting to note that in a study that we completed recently, that young people 18 to 22 years old were much more distressed and insecure than older ones. And it makes sense now. It makes sense because they're still carving out their life. They want to graduate, they want to find a job, they want to have a partner, get married, have children, have their own home, etc. And right now, between occupation, lack of work, the stunted economy, and now COVID, there's nothing in the offing. And they are stuck in the category of youth forever, because until things clear, because youth traditionally is seen as a stage, a biological change from childhood into adulthood. With these people, the 18 to 22, they're stuck in that with no end in sight. Maybe I should stop here and allow the chance for questions. Thanks.
Rita, wonderful. Thank you very much indeed. What we've heard really, I think, is quite an extraordinary, again, illumination of how COVID-19 has acted both as a stressor on the systems, but also how it's just exposed the as Ghassan was saying, the pre-existing political, economic deficits that we see across the board, both in Palestine, Lebanon, more broadly across the Middle East. And I guess before, I've got some specific questions from the participants. Before I do that, I guess what I want to understand from this is, first of all, do you think that the international community and humanitarian community appreciates what is going on and how COVID-19 has exposed these deficits? And also, change the therapeutic geographies across your region? And my following question to that is, if that's the case, if they have recognized it, what is being done about this? Or is this simply a matter of people just dismissing this as, you know, the same old problems again? I don't know who wants to start, Ghassan or Rita or Fuad?
I do not see a difference, quite frankly, in the way in which humanitarian aid is acting. And it acts in a contradiction. So humanitarian aid during emergencies comes in, begins to distribute food. I'm not suggesting that we don't need food, we do. The problem is that then when there is no crisis, we do everything we can as Palestinians to try to work towards development, as it is called. And then suddenly there's an emergency and all the money and all the attention is shifted. And then suddenly what we have built gets destroyed. That's one point. And the other point is that I do not see anyone of the humanitarian aid people asking, raising, advocating for the removal of the terrible siege on the Gaza Strip. And so as a result, if I don't see it, I don't see any change. It's as if it is a machine that functions for its own sake without really looking at what is happening.
Do you think, I mean, following up on that, do you think this has also exposed the problem around the failure to develop as well, in terms of constant humanitarianism without development? Fuad?
Yeah, I think I would second what Rita mentioned. It's you know, really astonishing that they are doing the same as you know, in other humanitarian crises. It's the same mechanism, the same reaction, the same you know, strategy to address whether it's war or besieged areas or, you know, or infectious crisis, or it's the same. So you go to the spot, you know, you give people food or PPE, or, you know, that's, you know, or the that's the same mechanism. Nothing about development, nothing about the root of, you know, causes, nothing about the, you know, the proactive issue for the future. And it sometimes it's more, to say it in that way, it's more discriminatory actually process that, you know, put those specific population in a one condition and dealt with that issue. So that, you know, look to what happened among Syrian refugees here in with all this goodwilling. You know, I'm not saying that they do that in a sort of bad willing. It's the same in Lebanon, in northern Syria, among IDPs there. It's the same mechanism. They go there and then they distribute, you know, that issue of protective procedures. But what about the, for example, you know, mass testing to see what about integrating those population in the national system? How that could be a sort of an opportunity to change the entire political economy approach. Still, actually, it's a humanitarian ideas thinking disconnected from the other political economic mechanism.
Ghassan, thank
So,
you.
there are two issues surrounding humanitarianism and what humanitarianism has become in this region, at least. Should speak about the things that we know of. Humanitarianism is predicated on the concept of temporality. Temporality, as we understand, cannot exist in a region which is now marking the 7th decade of continuous conflict. Temporality, and therefore the concept of crisis, is a concept that is laughable in an area where you should be talking about endemic political causes of ill health. The other issue is, and this is where we have now reached the end of humanitarianism. In the region, humanitarianism has become the subsidy of political oppression. Humanitarianism has become a mechanism by which oppressors in the region of different shapes and forms are allowed to titrate oppression so that people live beneath the quality of life that is a decent life, but just above the calamity of disaster. And what humanitarianism allows has become is part of this titration between the biopolitical and the necropolitical, between life and death. And so what refugees have live in this region is this titration where you are not living, but you're not dead. And so you don't basically ruin someone's dinner when they're watching Channel 4 because you're dying in front of the screen, but you have an incomplete life and a reduced life. And now humanitarianism has become part of the subsidy of oppression.
So, thank you.
I think it's more than that, please. It's not only a subsidy. I think it's an arm of the politics of the United States, especially, for example, when it comes to Palestine. It's one of the arms. The plans are to annex Area C. The United States says, Pompeo, for example, it's up to Israel to decide. And they all decide that a land that is owned originally by Palestinians, it can be taken by Israel simply because everybody has this guilt feeling, and then political agreements with Israel and the guilt feeling over World War II. And it doesn't make sense. So it's not just a palliative thing. It's much more serious than that. That's why humanitarian aid comes here. Governments give money for humanitarian aid to complete the political situation that is desired.
So I have a question. Before you do that, Fouad, let me just ask you, let me push you all a little bit on this. I guess this is my question here. The pandemic that we have at the moment has been altering the systems in ways that could be both predicted and unpredicted. So this is illuminating a lot of the pre-existing problems. It's also, as Ghassan said, creating a crisis. I guess if you were to look a year from now and assuming this pandemic just goes away and that, it fizzles out, what are we going to be left with? Is it going to change the ecosystems that you're all working in completely? Or are we just simply going to retrench back into our old ways again? Fouad, do you want to?
Yeah. I mean, I have one small tiny objection about, putting the entire humanitarian agencies in one basket. I do agree to a highly extent about the issue of temporality, about the concept of crisis, but I would be here to distinguish actually between, and I should say it like very clearly, that UN agencies that do such a sort of the humanitarians create this humanitarian system, comparing with the civil society organization that in a way or another there's a sort of struggling with that, political entities that represented by these UN agencies, so I would put a sort of a slight line between, these two major agencies of humanitarianism, and not on one basket. This is my argument, and I will come back to that if there's any time. Back to your question, Richard. I think yes, definitely there is sort of there's sort of change in the ecosystem. Look to now about the economy in collapse in such countries that already suffer a lot from consequences of very long conflict, very destructive system. So there's already there's a sort of a huge burden on the society, on the economy, on the politics. So I think and given the current situation in at least 5 or 6 countries in the region, I can see that this crisis maybe will push, as Ghassan put it, like a sort of, it's not on the exactly dead nor alive, it's in between. unfortunately, it could, in some cases, like among Syrian refugees, among Yemenis, I mean, to push toward more death, than being in this sort of in between.
I guess there's a question as well I want to follow up, and it brings in also a question from one of our participants, Professor Martin Bricknell, here at King's, the Professor of Conflict and Health, around international comparisons and the ability, and this is slightly instrumental because it's about the validity of the data that's reported, the testing regimes and the independence of the official reporting. And I guess it comes to this issue that Ghassan was speaking to about the need for research in the region, on why that's important, because I think it's fair to say there's been an extraordinary deficit in understanding the impact of the pandemic generally, not just at the political economy level, but even at the clinical level. And I wonder if all of you could kind of reflect a little bit on the clinical aspects of the pandemic, because there is a rather a feeling here that this just feel like rather a sort of transient ischemic attack for the global community. This is a warning. If this had been MERS, where we'd be seeing a 34% case fatality rate with the MERS virus, we'd be looking at a very, very different and very unpleasant picture here, despite the impact this particular virus has had. So I guess I want to talk to you about the importance of data and also the politicization of data. And it speaks to this idea of stigmatization. If you are tested positive, what does that mean for your communities? I wonder, Ghassan, Fouad, Rita?
So so immediately in Lebanon, and also, funnily enough, the Israelis did the same thing with regards to Gaza. Immediately, the discourse was that invariably it was going to be the refugees that were going to bring in the virus, and the Gazans that were going to bring in the virus inside Israeli society, despite the fact that in Lebanon it was obvious that people who were traveling, which kind of excludes the refugees, and those who were coming from the United States, 80% of all infections amongst Israelis came from the United States, were the harbingers. And so immediately you get that discourse waiting, praying for the stigmatization, basically weaponizing the pandemic to use against the population. When that did not pan out, unfortunately for those who were trying to peddle this, then there was the resurgence of this idea that the system is dysfunctional because of the burden that these people were putting on the system, i.e. that the Lebanese health system was dysfunctional because Lebanon is having to host these refugees, and so on and so forth. But I also want us to look at the flip side. And although I do share some of his worries, I don't share the extent of his worries, but not in this virus. And it is basically Giorgio Agamben's gloomy predictions of biototalitarianism and the permanent state of exception, i.e. that the response to such a weak, in terms of mortality, a weak virus, that by states is heralding a new stage in which biototalitarianism, in which these pandemics will be used by states as an excuse to take away people's liberty. The interesting thing for us as Palestinians is that at the forefront of the technology that is enabling the world to enter the world of biototalitarianism, where you monitor people and who they spoke to and who they came across and how far they were standing from the guy next to them, and facial recognition and voice recognition, is the Israeli security IT industry that had developed all of these technology as a way of managing Palestinian population. And so there is a huge growth in the sales of Israeli surveillance IT, which is now being repackaged and sold to India, to Singapore, to Korea, to the UK of systems that were designed to police and corral Palestinians. And so suddenly, surplus population that were the Palestinians of the West Bank and the Palestinians of Gaza and the refugees of the world and the favelas of Brazil, the technologies and the policies that were used to police these surplus population can then be designated to any infected population. So any infected population can become the surplus population of the Gaza Strip, or the surplus population of the West Bank, or in Brazil, the surplus population, because this management, this dystopian world in which these populations have lived, has allowed the development of the technologies and the techniques that can then be rolled out to the rest of humanity in a virus pandemic that might be more lethal than this pandemic. And that's the other flip side of the political geography, is that the geography of oppression creates a therapeutic geography of biosecurity that we are about to witness, that's being peddled at the moment. And then the amount of sales, I think I came across an article by the Israeli newspaper Haaretz, $9 billion in sales from Israeli IT security companies in biosecurity software that had just been developed for Palestinians.
Thank you very much. And I think this is, we could have almost an entire webinar on what's being described now as participatory signal intelligence, because the dual use nature and the interface between disease and surveillance technologies is something I think nobody really has discussed openly or looked at what the consequences mean for that. We're getting towards the end of the webinar now. Fouad, Rita, would you like to make any sort of last comments?
Yes, please.
Please.
Because I always like to end on a positive note.
Excellent.
First, just to explain, my hometown is Bethlehem. I have a family tree from 1636, and my family has been there ever since. So this whole notion of a land without people for the people without land is actually not true. That's one. The second thing is that despite everything that happened to Palestinians, we are here and we are staying. And to testify for that, what we have seen is that in moments of strife, even though many people might die, etc., social solidarity makes a big difference. And also something else which is very important, the moral imperative is ours. And that we somehow, it's part of the habitus of children. They know that with their upbringing, the moral imperative is ours. And so therefore that gives us the strength to be able to continue. Thank you.
Wonderful, Rita. Thank you so much.
Actually, I wish I could be Rietta to be, to end up with a sort of positive note, but unfortunately, I cannot see that positivity. Thinking about that, even with COVID, even with this very global, actually, crisis, still we can see now this sort of the hierarchy of power. So when because now the vast majority of cases, death are in the richest, more wealthiest, country, they were able, because of power, to have their own model to dominate the entire world, So every countries in the world follow with that sort of model about locking down, or sort of, excluding or isolating a type of population, whether they are old people or refugees or I don't know, and then end up, to have like will end up to have like a huge impact on the poor countries, the more vulnerable countries, that will at the end, will carry on all the bad consequences of that. And we can have many examples about diseases that ended up in Africa, and we stopped talking about tuberculosis or malaria, or as if like they are completely hidden diseases because it's not in the Western countries. So unfortunately, even with this another opportunity that was given to have something new, we still do the same model of power control.
Well, thank you very much. I think it's a very healthy dose of realism there, and it reflects the sort of light and the dark aspects of the topic today. We've come to the end of the webinar. It simply falls to me to say thank you very, very much indeed to my friends and colleagues, to Ghassan and Fouad from American University of Beirut, and to Rita from Berzeh University in occupied Palestinian territories. And to thank you all for joining, and for those of you listening to this as the recorded webinar. This was brought to you by the Research for Health in Conflict program, for which we're all members. Please do get in contact with us if you're interested in any aspects of what we're doing. Supported by the UK's Global Challenge Research Fund. Lots of topics to follow up on. I think it's one of the things particularly follow up on the participatory signal intelligence and the impact of biosurveillance and what that means for societies, because I think that's a huge topic in and of itself. But for those of you listening, if you have other ideas or webinars you're interested in, please do let us know. Ghassan, Fouad, Rita, thank you so much, and thank you to Kristen for sorting this out today.
Thank you all. Thanks
Thank
a lot.
you.
Have a lovely
Bye-bye.
day. Take care.
Bye. Thank you.
Bye.
Thank you.
Bye-bye.